SHIP is the State Health Insurance Assistance Program, and we are sponsored here in Indiana by the Indiana Department of Insurance, and we operate with a grant from the Centers for Medicare and Medicaid. So each state across the country does have a SHIP program, and they do operate independently. There's not a national number or something to call about SHIP, because some of the programs that are offered are they vary according to what state they're in. But we operate with, like, for instance, I'll talk to you about Indiana just because that's who I know. In Indiana, we have about 300 volunteers and also paid staff through various organizations. For instance, a lot of the area agencies on aging are SHIP trained, and the senior centers have staffs there that are SHIP trained. And by SHIP trained, that means that a volunteer counselor or counselors through one of those organizations has gone through a pretty intensive program about how Medicare works. It starts with a 4-day, all-day program to learn about Medicare. And after they've done that, then they will go to a local SHIP site where they will be stationed, if you will. They might work usually about 4 or 5 hours a week at a particular site. But when they start out, they'll go to the site and they'll sit with a trained volunteer to learn the ropes. I mean, obviously, they have to learn the procedures on their particular computer and how they answer the phone and so on and so forth, and where all the information is. Plus, they'll sit in while a SHIP counselor works with someone who is new to Medicare or already on Medicare and has an issue, so they can learn the ropes. And I always tell them, we've thrown a lot of information at you, but in about a year, the questions that people are asking you right now, where you almost struggle with remembering everything, those answers will just come to you as second nature. But if anybody, whether an experienced or new to SHIP, has a question, there's folks such as me or several other real experts in the Medicare field that can answer questions for people. You will never find a SHIP counselor say, "Gee, I'm sorry, I can't help you with that. Thank you for calling. Bye-bye." That will not happen to you. Many of our counselors have other resources too, that if you happen to mention a particular problem, they might be able to recommend you call this particular source. But I always say we're not a typical government agency, if you will, because we're staffed mainly by volunteers. So Medicare itself, I know, is quite confusing for people, and we help people in the beginning figure out how they want to take their Medicare, whether they want to use what we call original Medicare. That's the alphabet soup, A, B, D, all the letters, or they want to use an Advantage plan. Because we are unbiased information, we will not recommend one way or the other. We are not a sales agency. We're pure help. We can sign people up for certain parts of Medicare and can answer, a lot of questions for them. But again, we are not here to recommend. We will explain how everything works, and you still have to take some responsibility in what you want to do, because we don't want you at 65 signing up for Medicare, and then 10 years down the road, maybe this isn't the way you wanted to take Medicare. We don't want you saying, well, that's what the man or woman told me I should do, and it's really not what I, wanted to do or should do. So we'll walk you through it. We can help you choose a plan. We have what is called a plan finder. And what we can do with that is we can plug all your various medications in there, and then we can go and find a plan that best suits you. And one of the things that you can do when you're searching like that is you can get an online Medicare account, and that will keep track of all your medicines for you. And that's really important to do. Let's say you are a walking drugstore with 20 or 25 medications. if you have a Medicare online account, when it's open enrollment period, which is coming up October 15th to December 7th, that's when you want to look at your plan and make sure it's doing for you what you want it to do, especially in the end of drugs. But if you have that account, when you pull that up, that will show you all of the drugs that you're on. Now, you might not be computer literate, but this is what what we can do for you at our various locations. So when you pull that up, you will see online, you will see all your medications, and then you can add or delete to them. And then from there, you can perhaps look for a new drug plan if that's what you're looking for, or a new complete plan. For instance, going from an original Medicare to an Advantage plan, or looking at another Advantage plan. And, we do a lot of discussing about the pros and cons of each way to take your Medicare. The original Medicare is where you go to any doctor that you want to go to. And you will have a supplement to your Part B, which is your doctors and other services. And that supplement will take care of the 20% that Medicare doesn't pay for. So with that, you essentially end up with no extra costs. That's original Medicare. Original Medicare is Part A, which is the hospital primarily. Part B, which is for the doctor and durable medical equipment. And then D, which is the drug plan. And that's all versus the Advantage plan that is kind of an all-in-one plan. They probably, most of them don't have a premium anymore, but they do have a network of physicians and other services. And any of those physicians or services do have to be within that network. And those are the plans that do offer perhaps some dental or vision or hearing aids. And some other benefits too. Have to look at each plan individually to see what they actually do offer, because they do vary. I know there's a lot of confusion because you probably watch television, or if you're caring for somebody, they watch television. And I know you've heard this one particular individual screaming that it's free. What those commercials are, they're normally done by what they call third parties. So if you call them, then they're going to connect you with an insurance company. And those folks are also looking for people who could be in special circumstances. There's folks that are called dual eligibles because they might be on Medicaid or another program, and they can change their policy more often than some people. But those are advertisements, and they're annoying at best, but they really do add a lot of confusion to things. One of the big questions that's come up, especially since COVID started, and even as it hopefully winds down, is I am going to work past my 65th birthday. Do I have to sign up for Medicare? Well, if you have an insurance plan through your employer, and it also depends on the size of the employer, but let's just assume it's an employer with more than 20 employees, then you don't have to sign up for Medicare as long as they have what we call credible health insurance. And that is insurance that is equal to or better than Medicare. And that also means there has to be a drug plan in there too in the same situation. So when someone has insurance from their employer and their spouse has insurance through that employer, they don't have to sign up for Medicare when they turn 65. They will have a special enrollment period when they do decide to drop that insurance or retire, and they need Medicare. During that special enrollment period, that's when they can start their Medicare. There's no penalties, and they can choose the different way that they want to take Medicare. That's probably one of the biggest questions that we have, and also one of the biggest sources of misinformation that people get. We talk to people, and they're pretty insistent that everybody has told me that I need to sign up or I'm going to be penalized. And we always ask, well, who told you that information? And they'll say, Oh, one of my coworkers. Well, there you go. And also too, when people are signing up for Medicare, they might have a relative or friend in a different part of the state or a different part of the country, and they'll say, "Oh, I have this plan, and it's just great. I want the same plan because you might want the same plan because it works so well for me." Well, the one drawback to that is that a lot of the plans, especially the Advantage plans, go by county. So, if that person doesn't live in the same county as you do, they their plan might not be in, might not exist in your county, and also they may have different health issues that kind of determine which way you want to take your Medicare. So you do have to be careful about just taking information from a friend or relative and saying, "Well, gee, my sister-in-law told me that this plan works just great for her. I think I'll get the same plan." Um, that's not the way to do it. You need to examine each plan and kind of examine your own personal situation. Um, Now, this time of year, you hear a lot about the annual open enrollment period, which is October 15th through December 7th. And what that period is, it's the time of year when you can make changes to your plan. Or if you're remiss and didn't sign up at the proper time, you can sign up during that time. But any of these changes will start January 1st. So let's say maybe you're on original Medicare and you want to go to an Advantage plan. Now's the time you can do it. If you're on an Advantage plan and you want to go to original Medicare, back to original Medicare, now's the time you can do that. One of the drawbacks, though, is if you're out of your guaranteed enrollment period and you're on an Advantage plan and you think you want to go back to original Medicare, now that supplement plan that's going to pay that 20% that we're not paying, that supplement plan can now do what we call underwrite you. It's kind of like what a life insurance company might do. They're going to take a look at your health history and say, yes, we'll insure you. Here's the cost. Or no, we don't want to insure you because you just had a heart attack 2 weeks ago. But in general, that's the time of year, we check our plans, especially our Part D plans. Excuse me, I have horrible allergies. We want to check our Part D plans to make sure we're getting the best possible pricing on our drugs. A couple years ago, we had a case in Bloomington, Indiana, where a lady was paying a little over $30,000 out of pocket for her drug plan. And her doctor said, there's this organization at the hospital called SHIP who might be able to help you with a different plan, because I just don't understand why you're paying that kind of money out of pocket for this particular drug. Well, she talked with one of our volunteer counselors, and it was during the open enrollment period, and we did take a look at her plan and found that her plan just was not covering that drug. We found another drug plan for her, and it did end up saving her a little over $30,000. The good news was that she had the financial wherewithal to pay that kind of money out of pocket. The bad news is she had that financial wherewithal and just assume, well, this is life, and I have to pay what I have to pay and can pay. But by changing that plan and checking, that's the kind of money she saved. I mean, now that might not be the amount of money saved for everybody, but these days, if we can save you anything, it's important to do. So that's one of the things that our counselors do. But again, this time of year coming up, you need to look at your plans. You can change your plans, sign up for a plan if you were remiss in signing up before, and all those changes will start January 1st. But as you look at those plans, particularly any of the Advantage plans, you need to make sure that all of your physicians and services are within their network, and making sure that all the drugs covered are in their network. And then there's one more time when you can make changes, and that's January 1st through March 31st if you're on an Advantage plan. After the first of the year, you found out maybe your physician wasn't in the plan after all, or a drug wasn't covered or something like that. You get one more chance to change that Advantage plan. And we can help you, do that. But in general, we're here to help you with any kind of questions. We get questions every day. Just numerous questions, from veterans as to what do I do about Medicare, people who are still working, how does that work, and other, various questions. But each state does have its own SHIP program. And when we get all through, I can give you the number to, our 800 number or my number, and then we can always track down. Either we can answer your question or we can track down the, the agency in your area. But again, they're trained volunteers, and we don't have a dog in the fight as far as any insurance companies or anything. We can sign you up for the various programs, but our main goal is information and to make sure that you understand all of your choices and basically what's going on with your Medicare plan. I know there's lots of questions too about what's in the new, the new law, if you will. And not all of that has been settled yet, so I'm hesitant to give out information on that because we have not had, we're just reading what's in the news like everybody else, but we have not had a true definitive statement from Medicare as to what's going on. Many of those programs are not going to start for a couple of years. So, that's the bad news in that. But some of the programs are pretty good. I think I think we're going to see some improvements immediately and then in the future in Medicare to help people with the costs, especially, the drug cost. You hear about a $2,000 limit. That's not going to take effect for a couple of years. Beats me why they can't do more things immediately, but, I'm not the one in charge. So if you have any questions, maybe we can answer some questions for you and go from there.
Mr. Mueller, there's one question in the chat. It says from Kendra Smith. She's in Indiana.
Mm-hmm.
What part of Medicare is an individual that is not of age but would receive it based on their being disabled?
Okay, yes, somebody under 65 is eligible for Medicare if they're disabled. Also, folks that have end-stage renal disease, that's an immediate Medicare situation. But when you're under 65 and disabled, you become eligible for Medicare on your 25th month of disability. And then, and that could be somebody, quite young. And then when you turn 65, the clock does reset because you'll be able to look at Medicare and the cost involved in your choices as if you were a perfectly healthy person. Because when you're turning 65 and you're within your initial enrollment period, for instance, the company that gives the supplement, that 20% that Medicare doesn't pay, they can't ask you any health questions. The only thing they can ask you is your age, your sex, where you live, and did you smoke? Other than that, everybody is treated the same. There's no upcharges. That supplement can't say, nor the Advantage plan can't say, oh, we can't insure you because of X, Y, Z. So in with the individual, when they reach the 25th month, that's when they're eligible for Medicare.
Okay. Kendra, did that answer your question? Mr. Mueller, is there an annual fee when you're on Medicare that you have to pay or that comes out or whatever?
Good question. Yes, your Part B, which is the physician end of it, no matter how you take your Medicare, excuse me, no matter how you take your Medicare, that Part B is going to either pay it, or if you're not taking your Social Security yet, you pay it, or it'll come out of your Social Security. And And when you turn 65, you will be automatically enrolled in Medicare if you're taking your Social Security or any other government benefit. But I kind of lost my train of thought there. But when you turn 65, that's when you'll start your Medicare, unless of course you're still working. And that's what, if they happen to, sometimes people are still working and they're getting their Social Security, they'll get automatically enrolled, but then they just write back and suspend that Part B. Now, there are programs in each state that will help pay for that Part B if you are under a certain income. And that will help pay that Part B and some other expenses. And that will also tie into a program that's called Extra Help, which is provided by the federal government. And those have income limits too. You have to check with each state because some states have different income limits. In Indiana, our income limit is a tad higher than some of the other states. So if you were to call 1-800-Medicare and say, I'm interested in the medical savings plan, what are the limits? They will tell you the national limits, not what's for Indiana. So those do vary by state. But those are programs that are designed to help people with limited incomes. A lot of folks who are just on Social Security and their Social Security is not a whole bunch of money, they could be eligible for those programs because those are based on income and assets. And the assets don't count house or car. So it's just, basically, again, income and, if you will, money in the bank.
If anybody has as far as I know, you mentioned the Extra Help. Does that help with like prescription drugs if someone is not able to pay the, because prescription drugs are expensive? Is there a way that you all can help people that call in to find resources for, like, if they need assistance in paying for high cost prescription drugs?
That's what that portion of that program, Extra Help, does. The Extra Help will help them with their drug costs, and there's a significant savings in there. And that's one of the things that's going to be coming down the road with the new law in terms of a cap on how much somebody pays out of pocket, and then some negotiation on particular drugs. And I've got my fingers crossed that maybe some of those things still might be changed for the better because of, the fact that they are down the road right now on both of those programs.
Okay. Well, I don't see any questions right now. Do you mind giving a phone number and for people to contact? And if they're not in the Indiana area, even if they call you, you all are able to assist them in finding a number to contact for their local area?
I'll give you my number because I'm curious to know what, where our reach is and what kind of questions, people in general are coming up with. And my number is area code 317-283-4070. 317-283-4070. And, you can give me a call and, hopefully we can answer your question and, find a SHIP, proper site for you to go to.
All right. Well, thank you, Mr. Mueller. I don't see any other questions. Thank you so much for explaining about Medicare. I learned a lot, especially about the open enrollment period and things of that nature. And I appreciate you explaining more about Medicare because I know Medicare can be very confusing.
It does. It doesn't matter how much education you have, how much money you make, whatever your station of life is. It's confusing to everyone, and that's what we're here to do, is to sort it all out so that you make the proper decision because I always say it's as much a financial decision as it is a healthcare decision.
Mhm. And for anyone that came on late, we have put in the chat the number that you can call for the SHIP program. The SHIP program is very helpful and beneficial. It consists of trained volunteers who will help you to answer questions about Medicare, help you to just answer questions, help you navigate through Medicare. So the number is in the chat if you need to call and be further directed. And thank you again, Mr. Mueller, for coming on today.
Okay.
And we hope that this was very informative to all of you. Thank you, everyone. Please share this information with others and have a great day.